My name is Megan Towns, and I'm a physiotherapist and a PhD student at Holland-Bloorview Kids Rehabilitation Hospital and the Rehabilitation Sciences Institute at the University of Toronto. With the help of my co-authors, Peter Rosenbaum and Robert Palisano, two of the original developers of the Gross Motor Function Classification System, or the GMFCS, and my supervisor, Virginia Wright, I conducted a review to see how the GMFCS is being used outside of cerebral palsy. Our article will be published in the February 2018 issue of Developmental Medicine and Child Neurology. As many of you know, the GMFCS was developed for use with children with cerebral palsy as a means of stratifying based on their functional abilities and limitations as opposed to impairments in body functions. Since its publication in 1997, the GMFCS has become the international language to classify gross motor function of children with cerebral palsy, and many studies have provided evidence of its reliability and validity when used with this population. However, our review found that many investigators are also using the GMFCS to classify people who do not have cerebral palsy. Specifically, we found 118 articles that used the GMFCS with children and adults with 133 different health conditions or clinical descriptions other than cerebral palsy. The widespread use came as a shock and a concern to my co-authors and I. To the best of our knowledge, there is no evidence of validity for the use of the GMFCS outside of cerebral palsy, and in fact, it has been shown that there's a lack of validity when used with people with other conditions such as Down syndrome. This is likely because people with other conditions follow different developmental trajectories than children with cerebral palsy. As such, we concluded that the GMFCS should not be used outside of cerebral palsy. Furthermore, we found that many articles were using the GMFCS as an outcome measure. We thought that it was crucial to reiterate that the GMFCS was neither intended nor developed as an outcome measure. In fact, it lacks both the structural and the measurement properties to serve as one. Like any other measurement tool, the GMFCS should not be used for purposes for which it was not designed. When selecting a measurement tool for use in a particular study, researchers should examine the research question first to determine what type of tool would be required and is appropriate. Furthermore, it's necessary to provide evidence of reliability and validity of a given tool for a specific purpose prior to its use. Otherwise, it calls to question any conclusions based on the use of that measure. All this being said, the extensive use of the GMFCS among different populations suggests that there is a great need for other classification systems that are appropriate for use outside of cerebral palsy. As such, we recommend the development and validation of other condition-specific classification systems and the potential need for a generic gross motor function classification system. For more details about our recommendations, please refer to our full article. We hope that our work will be incorporated into research practices, and that if we were to repeat this literature review 10 years down the road, we would find that investigators are no longer using the GMFCS outside of cerebral palsy, and they're not using it as an outcome measure.